contextual factors in pain care, or in all healthcare, arguably, might be the secret sauce that we're not formally trained to understand in most academic programs for medical professionals or allied health professionals. Contextual factors are present everywhere. They're the environmental cues, everything outside of us, everything inside of us, our memories and our experiences, our past lives, what we lived as children, as adolescents, how we understood the world and how we learned through living in our world. Those are contextual factors that are within every individual and in the environment between two individuals, the room where you sit. All these subtle cues and not so subtle cues, our brains are picking them up. And how that impacts pain is a fascinating story. There are many different ways that neural networks in the brain are grabbing information from both the body signals, the chemistry of our body signaling from the bottom up, and all the different stored information that we have. So combined, something as simple as how you say hello to a patient, that nonverbal set of cues that we give each other, whether we look someone in the eye, whether we give them personal space, and all the different cultural considerations that we may or may not be even in tune with, could ultimately help someone feel safe or not safe. And the safety or threat evaluation of the world around us and the world within us, we now know from the science of pain, is a critical factor in pain production, pain intensity, dialing up, dialing down, the volume of pain, so to speak. So contextual factors are present everywhere. Knowing that that is an important element of pain modification or modulation, as clinicians, we have the opportunity to leverage that, to take advantage of some of the positive safety cues, such as asking someone permission before you launch into a physical exam. Very simple adjustment to clinical practice, but might be the meaningful moment in a therapeutic encounter that helps that person trust you instead of feeling threatened by you. And that's an important thing if you're doing an assessment on a joint that hurts. Just your presence or reaching towards someone's body part might make them feel threatened and their pain will dial up. And it's not a great indicator necessarily of the health of the tissue. When they say, ouch, that might be their pain alarm system registering threat. Might not be an accurate measure of the state of health of the tissues in that painful body part. So these are really important concepts for clinicians to understand and to recognize how much influence they truly have over somebody's pain experience.